When I'm anchoring on the news Monday to Friday to 5 to 7 a.m., we're waiting to hear the latest COVID-19 numbers to know how many people died and how many new cases there are. That's why I'm bringing back Dr. Alozie to discuss the recent report brought to my attention by El Paso Matters. Now, this is the title of it. Black El Pasoans, men underrepresented in COVID-19 vaccinations and state data indicate. Now, Dr. Alozie, we're African-American men. What needs to change to point blank just save lives?
I think it's about equity, right? So people often talk about equality, which is giving everybody the same access and the same approach. But if you understand that we're about 3 to 4% of the population in El Paso and less than 2% of the vaccines, there has to be an equity, right? So you find ways to get it into the black community, whether it's through churches, whether it's through ICC, whether it's through Alpha Psi Alpha, the Kappas, whomever it is, Black Girls Were On, the Links, Jack and Jill. But all those organizations, they're tied into the community, and they'll be able to get vaccine. I think, though, Jay, it's also important for people to understand the supply chain's not there, right? There's not enough vaccine. And so, but in the next few months there will be, and if the planning goes into doing that now, we'll be able to get it into all parts of the community.
And that's what really needs to happen. And another dilemma that's going on right now, I know the elderly right now, African-American El Pasoans, who are not aware of just how to get vaccinated. They're using the telephones right now. And just this Tuesday, we had another event going on, the Super Senior Sign Up, and that's residents 75 years or older. Now, there was 2,500 appointments available online and 1,000 appointments made available through the telephone. Dr. Alozie, just how could we help our senior citizens, because they have the wealth of knowledge that the young people need to hear about just to know where we came from?
Yeah, again, I think you sort of called it out, right? Whether it's online or by phone, I mean, thankfully there are phone appointments right now, and we heard the great news that the city and the county are going to join forces to streamline the registration process. I think that'll be huge. But again, I think that as a community, we need to get that information out to the churches and the various community organizations, because like you said, they're tied into the community. They know how to go find those super seniors. They know how to go find those members of their parishioners that have diabetes or hypertension, or they know have difficulty coming into church if church is in person. And so I think that really has to be part of the key.
And you know, something that's interesting too, I was speaking with one of my producers a little bit earlier today, and she was telling me that the last event that they had going on, normally the vaccinations were up in 2 or 3 minutes. This time it was 7 hours. So we're talking about people I just don't think that they know. So if you're watching this, even if you do need help, reach out to maybe your grandsons, your granddaughters, your sons, your daughters, to get that internet access to help you out to get that vaccine, because just like we spoke about, this is not the Tuskegee experiments anymore. This is 2021. A lot of research has been done on this. Dr. Alozie, thank you again. We'll have you back a little bit later in the show.
All right.
Now, also,